Good afternoon and welcome to Hospital HLWE Facebook Live Talk. This afternoon we have with us Mr. Yong Ngai, Hospital HLWE's Consultant General Surgeon, to talk on thyroid surgery with no scars. Mr. Yong received his basic degree from the National University of Ireland in 2002. Good afternoon and welcome to Hospital HLWE Facebook Live Talk. This afternoon we have with us Mr. Yong Ngai, Hospital HLWE. He is a member of the Royal College of Surgeons England since 2007. Mr. Yong obtained his Master of Surgery from University Kebangsaan Malaysia in 2012 and Minimal Access Surgery in 2013. Without further ado, over to you, Mr. Yong.
Okay, good afternoon, everyone. As we have planned, we're going to talk about a new way of doing thyroid surgery, where we can do thyroid surgery without extensive scar now. So I would like to not delay the time and go straight to the talk today. So this is a topic, thyroid surgery with no scar. Okay, usually what are the conditions that indicated for thyroid surgery? Whether you have a large thyroid, large thyroid, which the thyroid has encroaching or compressing the airway, causing difficulty to breathe, especially at night, snoring, loud snoring and breathing, difficulty in breathing, and also in a severe type of a large goiter or large thyroid gland can actually cause you to have difficulty in swallowing. This is one of the indications for thyroid surgery. And the other indication for thyroid surgery, where you have a condition known as toxic multinodular goiter, where the hormone of the thyroid are in excessive and causing something we call hyperthyroidism. This condition usually treated with medication first, and sometimes it will last forever, and when the medication cannot control the hormone level or cannot control the symptoms, then you might need to go for thyroid surgery. Okay. The third most common condition that you need the thyroid surgery is when the thyroid have a nodule, or even the nodule can be cancerous. And this definitely an indication for you to go through thyroid surgery. So what are the types of thyroid surgery that we do? Either we remove all, we call it a total thyroidectomy, the whole gland of the thyroid is removed. A hemithyroidectomy, where half of the thyroid gland is removed, and also almost more than half of thyroid gland removed, we call it a lobectomy, right? Okay. So in a normal thyroid, you have the left side, you have the right side, and you have a bridge in between. Okay, this is the normal thyroid configurations. So what are the common things that the common risk of thyroid surgery? So as a surgeon, I always tell my patients that there's 1% chances that you have a risk of injured the recurring laryngeal nerve. What is this nerve for? This is a nerve that goes into the voice box. When this nerve is injured, you might have some rough, soft, and even short speaking kind of voice, where it can affect the voice after this surgery. But the risk is very small. It's only 1% in either open or what we're discussing today, doing thyroid surgery by scope. All right. And another common risk of thyroid surgery is you may have 5 to 10% when you remove the whole thyroid glands. You also remove these tiny small glands that behind the thyroid, where this gland is what we call parathyroid glands. Para means next to the thyroid. And what these parathyroid glands do is actually maintain your body calcium level. All right. And unfortunately these organs are just very near or next to the thyroid, or sometimes even embedded into the thyroid. So when you remove the whole thyroid, there's a chances that we remove the parathyroid glands as well. What's the side effect? That you might have low calcium level and need long-term calcium tablet supplements, which is what we think is most of the time lifelong. Okay. Other side effect or complications of thyroid surgeries is most likely related to the operation itself, where when you have a thyroid surgery, you need a long incision to the neck. Then because of the scar and the muscles that we cut through to get the thyroid glands, you might have some neck tensions and tenderness after the surgery. Some of the patients may feel irritated windpipe, and some even go into swallowing problem. So this is the common effect of thyroid surgery because related to the surgery and the scar. All right, voice problem is usually because of the nerve, but that is bear in mind that risk of nerve injury is only 1%. All right, so normally how we do thyroidectomy, as this is the conventional way or the old way of doing it, or the so-called before we have video scope. This is the normal way of doing thyroid surgery, where the surgeon will open a long scar over the neck, go through all the neck muscles and cut through the neck muscle until we reach the thyroid glands and remove half or even the whole of thyroid from there, and later on repair all these cut muscle with sutures, and at last repair the neck scar. So the end effect of the surgery, of the conventional surgery, will have at least a scar over the the neck, which is sometimes can be unsightly and can be a stigmata that everyone see this scar or you're having, they know that you already have a thyroid surgery done before. Okay, and this scar can be very subtle, not seen, depends on individual. Some people have good skin that will not be so visible, but some people have bad skin that might be very visible and have some complication as well, especially like these A pictures here. They show uneven scar where look very ugly. All right, or B also another one. You have a big thyroid after the thyroid surgery. You have an uneven skin fold or further, or even uneven scar. And some patients can develop thick scar, what we call keloid. And all this scar will cause all the swallowing discomfort, the windpipe discomfort. And even so, sometimes the patient want to extend the neck, they can have this uneasy feeling of extending the neck. And the last picture will show you contracted scar, where the scar is stuck to the underlying muscles or even underlying the airway. So these all are definitely unsightly. But as fair skin patient may develop invisible scar, but dark skin patient might have this scar very visible. Sometimes those are depends on the patient itself. Okay, so to avoid having all this scar, now we have this new technique of doing thyroid surgery, where we call it endoscopic thyroid. That means we get away from the neck, not open a big scar on the neck, but by doing these operations using video scope, a small incision to insert the instrument through the chest and the axilla from this route. Okay. So at the end of the operations, you can imagine that only small millimeters length of scar, one bigger, the rest are smaller. The bigger scar because we need to take out the specimen from the scar, the thyroid, to deliver the thyroid from the bigger scar. The biggest scar through this operation is only about 1 cm, 1.5 cm. The rest is just 5 mm. So you have, instead of have one long neck scar, you only have 3 small scar where it can hide and it's not seen when you're wearing your clothes. Okay. So these operations is new, but is already gaining momentum and become more popular as it offer a good cosmetic result, and also it is safe, as safe as you're undergoing for open surgery, and it convey more benefit actually than open surgery. So what we do is, first, there is one scar for the camera, another 2 scar to these exact positions for the equipment, right? And we slowly tunneling to the neck underneath the skin, and not going through the lung, not going through anything, just underneath the skin up to the neck to reach the thyroid regions. In this way, we don't need to cut through the skin. We don't need to cut through the neck muscles, right? So it become, if you look at the pictures, you kind of misunderstanding, look like a big aerial operations. It's actually less invasive and less traumatic to compare to open operation, because there is no cutting skin and cutting muscle of the neck. Okay, so the advantage of doing endoscopic thyroid surgery definitely very depending on the technology of the video scope. As we have new technology, video scope are going HD, and sometimes some even go into 4K resolutions. Everything that we do with video scope will be enhanced and enlarged, magnified, enhanced and enlarged. And all these structures I mentioned, all these structures that I mentioned before, important structure I mentioned before, is very clearly seen when you using a video scope, like the thyroid glands, right, the nerve, right. All these are the important structure we need to identify and prevent injury. Injure them when we do operations. Is clearly seen on a magnifying image of the scope and the camera. So it is actually more safer, and it's very helpful for us to identify these structures, and also with minimal trauma to all these important structures, because everything's are in small movement and more precise ways of surgery or cutting each of all this. So the overall benefit of this operation is, one, you avoid a long and slightly scar. All right, definitely with small incisions and less long, small incision and no neck scar is less painful and less bleeding as well, because you are not cutting through so many structures to gain access to the thyroid glands, not over the muscle, not cutting through the skin so much, right? And because of the high resolution video scope, you can reduce, even further reduce the risk of nerve injury that cause voice disturbance, or reduce the chances that you have the parathyroid gland removed, the 4-liter parathyroid gland removed, and causing you having hypocalcemia. And because of less pain and less bleeding, the hospital stay also less. Usually my patient do the operation today, they go back tomorrow. So just one night stay. Okay. So this again, there's no visible scar. You can avoid keloid, you can avoid wound infections, and most importantly, you can avoid all the stigmatizations of thyroid patients. And less pain, no muscle cutting, no extensive suturing of the wound is needed. And you can save your time back to work earlier because of early discharge, right? And less tissue disrupt, less pain, less all those muscle tension, windpipe discomfort, swallowing discomfort, all are less. So, and one thing more importantly that I need to mention here, I put it especially here, is a lot of patients asking me, do you need to pantang after all, or need to take care of whatever food and drink you need to do, or certain activity you cannot do after operation? I can tell you that there is no need for you to restrict all your social and exercising activities, and there's no restriction of food and drinks, whatever kind. So the end result is either you have an open surgery with a long scar like this, or you come for endoscopic thyroidectomy without seeing any scar like this. Okay, and I think this is my last slide over here. I would like to end this, and thank you for your attention. If I have any questions, you can now post your question into the Facebook. I will try my best to answer each one of them. But I think to start with, I have a patient from Indonesia that asked me this following question. He asked me that if I suggest for surgery, did he need to get a second opinions, and is his diabetic affecting his surgery or not? So second or not second opinions I am here to tell William is up to you. It's whether you want to choose open operations or endoscopic operations. I have told you all the benefits and all the risks. So it's up to you to whether you want to get another opinions of that or not. But if you ask me whether your diabetes will affect your operations, I will tell you it will not, because it only depends on whether your diabetes is under control before operations. So if it's all under control before operation, this is not a problem. Diabetes is not a problem for this kind of operations. Okay. So I'm waiting for your next questions. If there are any questions, you post on the Facebook, I'll try my best to answer it.
Mr. Yong, there is one question that came in. After removing thyroid, will it still come back?
Okay, that will go back to I think the first two slides that, okay, I'll repeat the question. That after removing thyroid, will it come back or not? Okay, that is one, depends on the indication of surgery. Two, depends on the type of surgery you have, right? Remember just now I showed you the pictures, the animation of the pictures, what type of thyroidectomy that we doing, either the total thyroid, hemithyroid, or lobectomy. If you do a hemithyroidectomy, definitely you have another thyroid. Let's say you remove the right side, you still have the left side, right? So questions whether question, actually, I think you're asking whether your disease will come back again or not. That is depends on the disease. Okay, all right. If you remove the whole thyroid, definitely there's no more thyroid. There is no more recurrence again. All right. Okay.
Any contraindications for endoscopic procedure?
Yes. Another question come in is any contraindication for endoscopic thyroid procedure or any maximum size for endoscopic procedure? First, I will answer the second part of the question first. Actually, there's no maximum size. Sometimes if the thyroid is too big, we do try not to do endoscopic surgery because it is very difficult to deliver a huge thyroid through a small hole. All right, and actually, but it can be done. It can be done, but we try to avoid that. Okay. So far, if you ask me any contraindication for endoscopic thyroidectomy, I can only think about one, that you have this type of thyroid cancer called papillary carcinoma. If you have thyroid cancer, papillary carcinoma, I would prefer to do an open operations, because in this cancer that I need to remove all the neck lymph nodes, and thyroid and endoscopic thyroidectomy are not very suitable to remove lymph nodes from the thyroid, this type of thyroid cancer. So I would say that so-called now is relative contraindications. That means we have others factor to think of. So far, I don't think so have any absolute contraindications for endoscopic procedure for thyroidectomy. There's another question here. Any suture removal needed after the operation? Actually, I can tell you there's no suture removal. There's no need to remove any sutures after the operations. The sutures with a small wound, usually what I use is all absorbable. It will absorb after 30 days. You don't need to come back for any suture removal. This one. Okay, another question, a lot of questions. How long before I have to come back for follow-up? No, I mean after operation, how long we come back for follow-up? So my follow-up patients usually come back in 2 weeks' time. It's not if there's no complication from the operations and no problem after the operations, because one thing is whatever specimen come back, you need about 1 to 2 weeks to get ready. So your report of the thyroid specimen removed, you need about 1 to 2 weeks to get ready. So I usually put my patient after this procedure come back to see me about 1 to 2 weeks time. Any other questions? So if no other questions, I would like to thank you all the participants again, and I hope I can see you again in my next Facebook Live.